genesis and why it's important to think about those acts is if you get sick, right, wherever you are, the first facility or hospital, health center, dispensary, doesn't matter. You want to be able to know you can go there, get some sort of care, and if they are not able to, refer you, right?
Yes.
And have those records to transmit. So it becomes primary health, which is the first step, digital health because of that system and transmission and whatnot, right? Facility improvement is essentially you saying that any money I'm collecting in this facility, if I'm missing something, I don't have to requisition from, I don't know, county and whatnot. If I have some money, I can get it there, right? And all that needed financing. That's why the Social Health Insurance Act comes in. So the four were in very many ways important, so that they are helping us in this journey of ours, right? So then by that point in time, it becomes, okay, why do we need to change everything so that we achieve UHC, right? It became important, I think, for two reasons, right? One, of course, it's a political one, right?
Yes.
It's new government. They want to showcase they're coming in with something new. It's in the manifesto. It's all this and whatnot, right? So there's that. Then there's the element of what we had as NHIF had issues, yes, that could be fixed, but it wasn't comprehensive. Think about what I've just said is the element of digital systems, there's facility improvement and whatnot. NHF before was really more like a pair, right? You are sick, you're under a certain scheme, maybe that's where you'll get services paid through this, right?
Yes.
And if you think about it also, a lot of the issues that were in NHIF stood not just in the corruption, it was also the fact that people would take out NHIF or pay just when they're sick, then drop off, right? So there was an element of maybe the best approach is let's start from somewhere new, fresh. So there's that. Whether it's the best approach is a different story altogether.
Yeah, but at least we understand the quote-unquote reasoning behind it.
Exactly, right? So then we have the acts are in October. We're starting on this journey where people are being told it's free healthcare, but essentially it's not free healthcare, right? So we started on, and there were issues, and these issues really were, I would summarize them in two ways, and this is mostly from the guests I have on the podcast who are coming in, they're different experts, and you're asking them, hey, the same question you've asked me, what's UHC, what's this? And they say, okay, it is this by definition, but we don't know how it's going to happen. So let me, if today, Mariam, you're to come to me and say, hey, we're going to Diani. Let's plan a trip. Let's go to Diani end of October, right?
Yeah.
And I say, cool, because I want to go to the coast, right? There are certain things you have to tell me, right?
Yeah.
How I'll get there,
how long,
how
much it will cost,
those details, right? So we had a goal, right? But the how in between wasn't clear, right? So then the issues then became, one, it's the process. How will we do it? We're saying we're changing everything, right? Do we have, one, that contribution we're saying, how are we going to
get it? Yes.
Are the facilities ready? The human resource, are they ready? They're hearing that things are changing. Do they have new contracts? Because now it's a new system, right? The people who are seeking the services, now that they're being told you'll have to go here versus here because there is now a referral system, are they aware what that referral system is, right?
Okay.
So there was
so you can't just go to any hospital for any ailment.
Because the essence of primary healthcare is that you start from the closest, right? So that whole, all of us would flock to, say, Kenyatta National Hospital for even a cough and a cold, right? Doesn't make sense if you think about it practically. It should be wherever you are, you should be able to be treated for certain basic conditions. Then if they're unable to, they refer to the next one before you get there. That's the essence of that sort of hub and spoke model. They say, Untokapa, you go to the next place, right? And they're saying that would be important to not just decongest, but also to ensure that you're getting your services on time, right?
Yes.
And it will